Hey, what's up guys? Today we're going to be talking about pyelonephritis. Pyelonephritis refers to inflammation of the kidneys due to infection. The most common cause is vesico-urethral reflux, where contaminated urine in the bladder backs up into the kidneys. It usually starts with a bacterial infection such as E. coli in the lower urinary tract. The infection typically ascends from the bladder, causing inflammatory damage to the kidneys. There are pre-existing factors that could usually lead to pyelonephritis. These include urinary tract infections or UTI, kidney stones, benign prostate hyperplasia, also known as BPH, diabetes, and even pregnancy. Pregnancy increases the risk of pyelonephritis due to changes in the urinary tract, and unfortunately, this may lead to preterm labor. Now, pyelonephritis can lead to chronic conditions when the kidneys are scarred due to ongoing repeated infection. Pyelonephritis can also lead to acute intrarenal injury where the kidneys are damaged. Lastly, the infection can spread throughout your body and can lead to urosepsis. Urosepsis is when the infection from the kidneys becomes systemic, where bacteria travels through your bloodstream and activates the inflammatory response. The symptoms you might encounter are malaise, fever, chills, and costovertebral or CVA tenderness, which is a flank pain or lower back pain. You might also see symptoms of lower urinary tract infection and nausea or vomiting. For diagnostic tests to rule out pyelonephritis, we can check their urine analysis for white blood cell casts. Typically, white blood cell casts are not found in the urine unless there is an infection in the urinary system. Complete blood count to see if their serum white blood cells is elevated and if the infection becomes systemic. Blood culture to check for bacteria in the blood if the infection becomes systemic. CT scan without contrast if the kidney is damaged. And ultrasound, which is another imaging test. A patient with severe kidney infection needs to be admitted to the hospital and treated with IV antibiotics such as ciprofloxacin, ceftriaxone, ceftazidime, and ampicillin. We can give them phenazopyridine, also known as pyridium, for relief of painful urination, administer antipyretics for fever, administer IV fluids for dehydration or if the patient's blood pressure is low, and of course, the main priority is to prevent and treat urosepsis by aggressively giving IV fluids and antibiotics and identifying the cause of the infection.